Okay, everyone, we're going to go ahead and get started with our next Pharma Talk. So you are here about to listen to how to create a winning team and motivate your staff. And today is all about building a winning team and effectively motivating that team. And we all know, especially in today's environment, it's tough to hire. And also, once you have people hired, if you're fortunate enough to do that, to keep them motivated and to keep them working hard for your patients and your community. So I'm kicking things off here. My name is Mark Crouch. I'm one of the vice presidents of pharmacy retail operations for Health Mart and McKesson. And I support all of our sales teams in the Southwest along with our Health Mart customers. So think of me as kind of a business consultant on all the McKesson and Health Mart tools, resources, solutions, and platforms and all those things out there to help you run your business. So it is my pleasure to announce our guest speaker here today. Christian Tadrus is the owner of Sam's Health Mart Pharmacies in Missouri. They specialize in both community and long-term care pharmacy services. His pharmacies focus on improving patient outcomes through a variety of clinical interventions, including medication synchronization, adherence packaging, immunizations, point-of-care testing, and comprehensive medication reviews. In his spare time, and this is pretty impressive for me, is Christian is also actively involved in several boards across the country, including the Missouri State Board of Pharmacy, the NCPA, National Community Pharmacy Association, and the National Council for Prescription Drug Programs. So thank you for your leadership with all of those boards and really helping to drive pharmacy forward at the national level. But without further ado, we'll invite you to the stage and look forward to hearing your presentation. Thank you, Christian.
All right. Thanks, Mark, for that introduction. I really appreciate that. Everybody hear me okay? All right. He forgot a couple of things. Also involved with the Partnership for DSCSA Governance, which is all this track and trace that we do. And our teams are now going to have to pick up and learn how to move data around as we move our product around. And also involved in Missouri's state PDMP, which for many of you might know, Missouri was the last state in the union to finally get one of those things going. And that's been fun standing up as well. I say that because I'm an owner of pharmacies. I have 3 community pharmacies that are also long-term care pharmacies. And we also have a direct primary care clinic in one of our pharmacies that we started this last October. So we've got a lot going on, which I'm sure many of you do as well. But I'm also somewhat of an absentee owner because I'm doing these other activities. And that's not an uncommon situation when we have a lot on our plate. As you've heard from, if you attended Hugh Chansey's speech on management abilities and our speaker at lunch, Penny, today, a lot of those things ring true. And quite frankly, when I heard that, I wasn't sure what I was going to say up here anymore. But because I think that's all good advice that you're hearing from those 2 speakers. Today, I'd like to talk about some of our journey, some of the challenges we've gone through, and what we found that helped us create our team, help our team perform and continue to perform, either in the absence of the leaders or in environments where we were continuing to throw things at them to challenge them to step up amidst the same challenges that all of us are having, people not coming to work, asking them to train, learn new things, still make sure the pills get put in the bottles and the people get serviced well, and that there's money coming in the bank. It's almost an unwinnable scenario. But if you use some of the strategies that I'll recommend today that will either work for me or that our other speakers here at this trade show and education event are touting, I think you're going to find that keeping your head down, focusing on the important things, solving each problem, and then solving the next problem, we do get through these events, and we end up with stronger teams because of it. That is a bad picture of me. I apologize. So there are probably 3 areas I'll cover here, 3 categories of topics I'd like to talk about and what I think is really kind of important for you to focus on when you're thinking about what you do back home. And just the idea of the optimizing team performance is really around, I mean, if you think about what the word optimize means, what does optimize mean? In short, it's really balancing your resources and your goals, right? You have goals and you have resources. And what we have in our world, a lot of goals and probably less resources than we need to pull them off. So it's really important that we recognize that a lot of the stress and a lot of the pressures that our teams face, or that their failures or their fear to engage really comes from their realization that they're not resourced properly for what the goal is, or that they don't understand what the goal is. And that's that first bullet point up there, that idea of a clear expectation. I used to believe that my people were tracking along with me, and as I mentioned, I'm doing a lot of things. I'm on the forefront of a lot of what's happening in the industry, hearing it well before day-to-day pharmacy people hear this stuff, usually involved even in rooms where things happen. So my mind's always thinking, okay, we need to be here for this at this time. So I'm generally way out over the skis in that respect, or at least forward in terms of positioning our pharmacies, which creates a lot of stress and sometimes is unclear for our teams. So what I found over the years is if I were, and I'll go home from this event just like you will with 3 more ideas to throw at them, and they're going, oh my gosh, what's he got for us next? But really, it's really just about setting clear expectations. It's like, here's an opportunity for us. Here's a focus item that we need to do. We need to understand what we're up against and talk about what it looks like to be successful in this program. So I used to assume that they would follow me. I used to assume they would understand when I gave them the initial discussion on it. And I'd say, great, let's go get it done, and leave it to the teams. And then it wouldn't happen. Sound pretty common? Maybe, yeah. Because I'm busy. I got to do some other things, so we've handed it off to you. That clear expectation, I had to change my game with that a lot. It really came down to, this is what I want, or this is what has to happen. Almost to that level, not in a dictatorial way, but in a being clear. Does this make sense? Are we clear on the outcomes here? Metrics. We actually had to be very specific on the metrics, sometimes when we didn't know what the outcome was going to look like. So that was that incremental piece. So when we were bringing on a new program, let's just say we do a partner program with an area agency that has a consortium of people. We were going to bring in our community health workers and then embed them in their environment and ask their people to embed in ours. That was a very good lesson in learning about clear expectations, because we had 2 parties coming together that didn't understand. They knew their game, but they didn't know the other person's game, and they didn't know what the vision was initially for us working together as a team. And what that took was us sitting down in rooms, telling and learning about each other's goals and understanding of how they operate, and then somebody with the vision to very clearly explain how we're going to seam this together and what the outcome of putting everybody together was. And that was something that management had to take forward. We had to actually sit down, be in it with them, and work with them directly. And I think that's a key thing in getting to clear expectations. It's not, here's what your goal is, go do it. It is, let's get in this together. Let's understand what bosses are asking you to do and what we're trying to do, and then be very specific. Feedback loop that we all get into. And then I want to be clear about this. That's that communication piece that we always want to build into our processes. Feedback can be a good thing and a bad thing, as we all know, right? You can have that annoying feedback that comes with its noise, it is pain, or it is blame. We really want to stay away from that. And we've done that in my business inadvertently, because people will be forced feedback, right? I'm going to give you some feedback here, whether it's an employee engagement or whether it's saying, hey, here's your bad metrics, you got to get on that, let's get that thing done. What we want is a good feedback loop, right? We want feedback coming to management, as well as we want management providing feedback and support the other way. So it is a loop in this respect. It's continual and engaged. A couple of our projects, we actually let our people design the feedback loop. We said, we understand that feedback can come across as one way. Give us an idea on how you would like to have your feedback handled. And we had one of our stores team, we had 3 stores, so we asked them all, and they all came up with slightly different versions, but we got it aligned. In a scenario where they wanted to be the ones that actually called the meetings for the feedback. And we said, okay, that's not a problem. What cadence do you want to do this on? And they said, we'd like to do this on a monthly cadence. And I had thought we probably ought to be doing that more frequently because I wanted to be on top of it. But what you learn from that is that was their control mechanism, and that was in this particular project, they wanted the ability to control and prepare for the meeting effectively. And they wanted some time to be able to do it themselves. And so that led into just kind of what we're talking about here, these ideas of saying, okay, thank you for taking on the project. Help us design this. Help us, what does this look like with the components that we need to do, whether that's goals and setting of metrics, whether that is the feedback loop, or what is that about that you want to control and what you need us to control or resource for you. So we've been very successful about, once we got through a couple of those examples where we're asking you to design the program, you get to set these components. It developed a little bit of control that they felt more comfortable, and the ownership started to evolve. Talk about that in a minute, but it also helped us understand where the strengths were in our organization. These untapped resources we all have in our organizations where certain people have skills and interest even in taking on more, but they've just never been asked. And so we didn't know that before. We never did psychological surveys on anybody. We didn't really sit down and have a monthly meeting with somebody and kind of look at what their goals and pieces are. We relied on our teams to identify the skill sets. But until we challenged our people, we didn't see some of that develop. So we've actually moved much more into this engagement process. We don't use a formal survey like you heard Hugh Chancey talk about, but we do sit down with our people individually and take them to lunches. We ask them very specific questions. What are you interested in? Through our community health worker training, which is really about aligning heart and mind around health topics like health equity, social determinants of health, all these things that you really start to get to understand what it is people are dealing with in their lives. When our teams, as they learn those skill sets, their whole approach to even coming on board changed. We started using those techniques too, because we took the same surveys and interviewed our actual employees the same way. And we learned more about each other that way than we did through any sort of payment program or paid program to survey psychological evaluation that we had done historically, but we weren't doing anymore because they were costly. Why? Because that type of understanding actually brought in the relevance at which is our employees in the communities in which they work. We were picking up on where they were really good at managing certain types of scenarios, whether that was a cultural issue, whether that was a conflict issue, whether they had some sort of trauma in their background, whether they had health issues that were affecting them coming to work. So that community health worker engagement and that survey process can work internally, and it brought us to the awareness piece of understanding who had what strengths where. With regard to like management decisions, we were very much a top-down, we can't do anything without asking Christian what to do, which always bugged me because I'm like, you guys have to do this. But the leverage of the strengths was that we found that many of our managers wanted the goal setting to happen and then just let them get to it, right? And you guys have some of those people out there, which is like, got it, boss, let me know. Some people wanted more hand-holding. They were actually quite afraid to take on the leadership role, and we almost had to push them into it. But once we found the strengths, we had some that wanted to be followed, and we had some that wanted to lead. And once we identified that, we had to trust as management, let them go. Let them do it. Let's see what they do. And we were amazed at how many of these people took this stuff and ran with it. Some things that I wasn't tracking very closely, and I just trusted that it was going on because I'd been traveling. I came back, and they had built a program, exceeded goals, and moved on. And I'm like, okay, I get this. This person is a high performer, but we didn't know it because we never let them have the opportunity. So it's a simple stuff, I think, but and we discovered it through action, but it's really engagement. It's using these concepts that we see in community health education, providing feedback in a positive manner and letting them provide feedback to us, being the good listeners, and then being very clear about what those goals are. What are we trying to achieve? Get buy-in there. We continue to get really good buy-in in our particular environments when we put purpose and meaning towards why, the why we're doing these things. I can come back from any type of these conference, or I can be involved in some sort of social initiative at the national level, or I can be involved in some sort of let's advance the practice of pharmacy. But why are we doing that? And it's okay to be financially focused because there's money in it, But there's also some things just because it's the right thing to do, and many of us react to that. Sometimes it's just something simple like, we won't be here tomorrow if we don't focus on project X or Y, which we've heard today is profit. But when people can subscribe to that vision, when they put their heart and mind, they see that that has purpose and meaning, they're going to work much more diligently for it. And they're going to perform above and beyond. Our particular operation, because we're engaged in community engagements, local as well, but also the advocacy level, I basically tout two pillars, so to speak, which is the advocacy for our profession, which also would include our patients, and the local patient. These are people that are close to us and need our help, right? If we don't do it, who's going to do it? Those are two very simple ways to go about motivating people, but at least within our profession. But that purpose and meaning is what drives me. I tell them why it's important to me. I ask them why it might be important to them, and they actually do come forward with some things that I hadn't thought about, which makes it important to me because I want to help them now get their goals. So tied in with letting them lead, you can also tie in the purpose and meaning. Why do you want to lead? Because this is meaningful. We have a chronic kidney program grant with the National Kidney Foundation, where we as pharmacy team are actually screening people with hypertensives and diabetics to identify whether they have the early stages of chronic kidney disease. I didn't know this until we had gone through some of these processes, but it was important to me because it's validation of pharmacy teams being able to impact care and get people referred to lab work and then possibly save their kidneys over time. But what I didn't know is how many people in our employee had been affected by chronic kidney disease over life and had lost either kidneys or had lost a loved one to chronic kidney disease early. That put a lot of purpose and meaning to those things, and we had people jumping at that one because it was meaningful for them. They understood it. They were doing it because it was the right thing, not because the bosses asked them to do more work. Recognition and appreciation. This thing I think we all think we do really well, but you don't know until you ask or until you're recognized. You have to do it, and there's that balance between doing it between the lines, not too much, not too little. Is it financial only, or is it just recognition? One program that we put into place in our pharmacies that seemed to work was we were detecting, we'd done a lot of raises to try and keep people coming to work through COVID and so forth, and our technicians are making really good money right now, and that was motivating, and that put some dedication towards the job. But what we found was at some point the money was nice, but that wasn't what their motivating factor was. But what we really started to notice with our staff was that when we were so short-handed or we couldn't get somebody to come to the pharmacies to fix something, for example, that somebody was bringing their toolbox, example, from home, and they're fixing the back door because the hinges are falling off or something like that. And they just did it. Why? Because it had to be fixed, and we were struggling trying to get it done. We had people that would do after-hours home visits for people just quietly. We didn't know they were our customers. We had no idea they were doing this. That came up a couple times, and we're like, wow, that's really cool. We have people, and we probably all have things like this, where you have your delivery drivers do something for somebody, but we have people that work self-coaching. Because of some of the training things we've asked people to do, some people were struggling trying to get there, and although we encourage our teams to help them learn how to do these things, we found that some of our coworkers were helping their coworkers quietly become better at that, so they had more confidence to step up, which I just love that self-help thing. It's like, put your arm around it, and we're going to be together. We're going to get this thing together. But so out of all those types of little examples that we were seeing, we actually created something called the Above and Beyond Awards. It's not a lot. It's a $100 type of extra paycheck for people every month. But what it is it's something that we're recognizing they're doing something above and beyond their job responsibilities. They're doing it voluntarily, and they're doing it because it's the right thing to do. And that little thing there, you should see, or they get a thank you card, they get a nice gift, they get a small gift bag like that. We present it at each location each month. They're nominated at each location by their managers. The teams can nominate a manager. But this one small program, it costs us $1,200 a store a year, has really brought in some nice thank yous in the process. But it's just one example of what you can do, little things you can look around the edges and notice. I think people appreciate it. We've had a few people donate their gift cards or their $100 to their cause, which is great. So it's all built in that purpose and meaning scenario, but it's really nice to see people like to be recognized, and it's not about the money all the time. I mentioned a little bit about the inclusion and empowerment. That's really about what do you want to do with this. So a high-performance team is probably going to want to be included in things. So they're going to need to be included if you're going to have them be a good team. If you're communicating in silos, if you're not being involved with what's going on and understanding how they're executing their job, or they don't have the information to execute their job, then you're not going to get the results you're going to get. You're going to be spinning your wheels. Inclusion, to me, is really making sure that we're always talking about us as a team. You have the information. If it's available, you have it. It doesn't matter if you're a pharmacist or a technician or a CHW, you have access to the information. We're not overly restrictive on that. They understand their job is to come in and be part of the team and support the team, and they don't need to ask permission for as long as they understand what the limitations are on accessing it, HIPAA rules and things like that. Why? Because we want them to understand this. So one of the things we did years ago, I think some of you may have, we have an intranet where everybody can see information about the programs we're doing. We have a blog that we put out on that so they can be kept up on it. They understand, even if it's not really relevant to what they do, they're aware that that's happening in the company, and they would be able to refer to the person who would know. That little intranet thing has been very helpful because it's also a quick reference to anything. Many of your companies probably have that. A lot of small pharmacies won't. We also copy people on emails quite a bit. Some of them very open discussion. Now, none of the HR stuff and that, but when we're talking about a program we're talking about developing, and it starts with a small group of people maybe emailing, or we're actually copying and bringing people in constantly, and eventually that conversation's gotten to the point where the entire team sees it. Mainly because we want them to know it's coming, but what we also want them to do is understand that they are part of this solution too. It's not this little group over here that does that. No, this is what we do. And so we want you to be informed of this. We're not doing so many that they're getting information overload, but what we found was our teams were more primed for when we said, this will execute on this date. And it really helped. It was actually more of an efficiency thing from our standpoint because it was less bring them up to speed stuff because most people were seeing it already. We had to really step back from the idea that this might be overly competitive or it may leak because, quite frankly, if our programs leak out and another pharmacy wants to do them, great. It's stuff that they should be doing anyway. So we were okay with that leadership thing. Ultimately, what we're trying to do is create a positive environment for everybody, right? Nobody wants to come to work in a place where everybody's negative, and it's really hard not to be negative in today's environment, but I really think that falls on the leadership. I tend to take everything and flip it when I see something negative. I say, what's the positive in this, right? What can we learn from this? Or let's just not worry about that. We're just going to keep our head down and keep going. The spirit of being excited to come to work, this idea that if everybody walks in the room and they're excited to be there, that team's going to perform better. They're going to be happier. They're not going to be distracted by things that will put us, off our task. They celebrate each other's wins in a lot of ways. So I think it falls on the leadership, but we also ask our teams to lead from behind if they're not necessarily in the lead roles in these things, and to always do a positive spirit. A lot of what we do when we hire now is we set some of this groundwork rules. And this has really been helpful in keeping the team operating through tough times. For example, when we hire, we make it known that the goal of this arrangement is for us to make money. Your job, take it or leave it, is to put money in the bank, to help the company make money. The way you do that is through all these activities that we perform and using the skill sets we have to perform them, and we do them safely. But that's your number one goal, to put money in. So that's a good level set for keeping people on task. Keeping people's attitude right is the next thing. And we deal with, quite frankly, we have a lot of HR issues, like everybody else might. But we set the groundwork up front and literally just say, look, the basics come down to it's your attitude and your behavior about your job, right? We expect you to come in positively. If that's not working, we're going to get engaged. But quite frankly, all HR policies loop back into your behavior and your attitude. So keep it positive. Let's turn everything positive, and we'll go from there. We've had a few people that have challenges in that, like on all organizations. But when you bring it back to this isn't working, outcome's not doing, it's either a decision to not focus or it's a decision to have a negative attitude about it. Let's focus on the attitude and we'll go from there. So I know that's kind of a broad thing, but it really is a simple thing. And I think most of high-performance teams will work from a baseline of just having simplistic rule systems to follow, because most things will distill down to attitude. Work-life balance, we do not let our people have access to their email off work. We actually keep it behind our firewall. Limited people might need a remote access for a very limited time. Why? I don't want them having to be at work when they're not at work. We'll call you if we need you. That's one thing that's worked for us. We have, just because of staffing, but also because we wanted to make sure that our teams had more off time, we shut down 2 of our stores on Saturdays and Sundays and left 1 open. We're in a geographic area that's close enough to do that. And we worked very significantly on getting in front of things like the sync programs and so forth, and calling our long-term care facilities on the Thursdays and Fridays to get in front of that, to buy them those weekends off. As a pharmacist, I travel, of course, so I work a lot of the weekends. My pharmacists get 3-day weekends most of the time at this point. But that really went a long way, and that really gets back to meeting your employees where they have interest. We have dabbled in the remote access stuff as well. So the work from home thing has been very scary to us because we do physical stuff like put pills in bottles and package things. But we have started a process by which we do shadow teching and rotating. That allows everybody to have a fair chance to have some time at home. But we're not going to do full-time because it just pulls too many people away from us. We also have a shadow tech program that allowed them not to have to travel distances to back up a pharmacy that had less employees or was in danger of not being able to open, and we had to just shift a tech or a pharmacist. We created a model in which they can actually stay at their home store, which might be closer to their home, and actually act on behalf of the pharmacy. That I didn't realize. I thought this was something that you could just say, look, we're all part of the team, let's go. And I realized that what we were really eating into is a lot of their private time and the extra hour drive there and back each time. So we met them halfway and did that, and it's been a great program because it's now set the agenda for us to move on to more remote stuff. I'll leave you with this, is that whenever something comes up, somebody comes with an idea, stop, say thank you, be engaged, and congratulate them. So hopefully some of those things give you some ideas or some thought processes. Thanks for listening.
See, Christian, I told you that half hour would fly by. Great job. I really, I learned a few things, and I'm not going to regurgitate everything because I can't do it as well as you just did it, but a couple of things that really spoke to me was you talked about how a lot of these concepts are pretty simple, right? But it's putting them into action and making sure that they happen. That really resonates with me. And then the why. You know, I struggle with that in my, personally and professionally, but personally, when I know why I'm doing something, it resonates a lot better than just being told to do it. So
I'll say the why is probably the key thing in all of this, because aligned teams where your team is aligned with your mission and vision, and they see it, they speak it, it's heart and mind to them naturally, those teams optimize their behavior. You don't have to do as much for yourself because their team already is desiring and knowledgeable to do it. So try and put your team members together that think alike and act alike in that respect, and that you're going to have a high-performing team because of that.
Awesome. Well, thank you for your leadership. Thank you for presenting today. And round of applause for Christian. Thank you very much.